Hello, my name is Jian, and I'm an associate professor of bioengineering from the University of Texas at Arlington, and also the senior author of the paper we will be talking about. I'm joined today by Richard Tran. He is a postdoc fellow in our lab, and also he is the first author of the paper. Today, we would like to talk about our recently published paper in GIE entitled Injectable Drug Eluting Elastomeric Polymers and Novel Submucosal Injection Materials. This paper results from our collaborative effort between the University of Texas Arlington and also the University of Mississippi Medical Center. Our co-authors are Dr. Thomas Abel and Jian, who are professors of medicine and gastroenterology from the University of Mississippi Medical Center, who will provide some background information and the motivation of this study.
Endoscopic mucosal resection and endoscopic submucosal dissection are minimally invasive procedures for the treatment of mucosal dysplasia and cancers in the gastrointestinal tract. This procedure requires submucosal injection to increase the safety margin. Unfortunately, EMR and ESD are limited by the short submucosal lift durations with currently available injection solutions, such as saline. Some recent studies have introduced injectable in situ forming hydrogel materials for EMR. These injectable hydrogels could provide extended submucosal lift durations. However, many of these gel-forming materials are plagued by difficulty during administration and significant inflammatory responses. Dr. Yan, would you like to talk about the rationale behind the new EMR solution?
The purpose of this study is to evaluate the efficacy and the safety of a novel injectable drug eluting elastomeric polymer, we call it IDEEP, as a submucosal injection material to assist EMR and promote wound healing, which was barely considered in the previous studies. Our technology is based on our recent patented technology. It's a new polymer. It's called polyethylene glycol malate citrate, PEGMC, which has been shown to have excellent cyto-tissue compatibility and controlled degradability both in vitro and in vivo for tissue engineering and drug delivery applications. The ability to be injected using minimally invasive method and deliver therapeutics in a controlled manner has prompted us using this polymer as a new EMR injection solution. Unlike previous materials, IDEEP utilizes both viscosity and gel formation to overcome the limitations of previous design. By dividing the system into two separate components, Part A and Part B, this system offers a huge advantage over previous designs in that the surgeon can precisely control the gel setting time, setting location, and avoid premature gelling inside the delivery tools. After tissue resection, the residue hydrogels in the tissues enable a controlled release of ribamypide, which stimulates the mucosal wound healing. Eventually, all the residue hydrogels can be completely degraded, leaving no foreign body materials. To our knowledge, this is the first injectable solution that can not only facilitate EMR, but also potentially promote wound healing via controlled drug delivery strategy. This is a perfect example that bioengineering technology opens new ways to solve clinical problems. Dr. Chen, would you like to talk about what exactly was studied and what were the results from your work?
Sure. Thank you, Dr. Yang. A comparative study among 3 different solutions was carried out using material characterization tests, such as maximum injection pressure, ribamypide release rate, and ex vivo submucosal elevation duration. To assess the preliminary in vivo efficacy, standard EMR procedures were performed in vivo using a live porcine stomach model. And what we found was that the IDEEP component could easily be injected through a 25-gauge endoscopic needle. The IDEEP-B solution was even easier to inject, showing similar injection pressures to that of normal saline. The in vitro ribamypide release from IDEEP gels displayed an initial burst release, followed by a sustained release for up to 2 weeks, and could be further controlled through polymer formulations. In the ex vivo studies, all the submucosal cushions created with IDEEP were more durable than those performed with saline and sodium hyaluronate at all time points. No significant changes in ID cushion height were observed after 5 minutes due to gel formation. To evaluate the efficacy of ID, standard EMR procedures were performed in vivo using a live porcine stomach model. The IDEEP-A was injected using standard delivery tools and was able to create an adequate submucosal cushion. Using the same injection needle, the IDEEP-B solution was then injected into the same location without any clogging inside the delivery tool. After 5 minutes of IDEEP-B injection, the en-bloc resection of the elevated mucosa revealed a soft biodegradable gel underneath the mucosa to provide protection for the underlying muscle layer from the electrocautery damage. The presence of the IDEEP gel did not complicate the resection procedure or require any changes to electrocautery settings.
So Richard, what are the limitations of this study? Maybe you can comment about that.
Okay, well, the in vivo resection procedures in this study were only used to determine the preliminary efficacy of the IDEEP system. Further long-term studies in living animals with pathological review are needed to confirm the long-term safety, efficacy of tissue resection, and submucosal regeneration. Dr. Jian, would you like to make a quick conclusion about the study?
Okay, so IDEEP is a cost-effective, readily available, and easily injectable two-component system, which allows for biodegradable gel formation under the submucosal space without complex administration difficulties, and can potentially aid in mucosal regeneration through controlled therapeutic delivery. This result suggests that our IDEEP system may provide a significant step towards the realization of an ideal injection materials for EMR and ESD. We are very interested in translating this technology to help patients in the hospital. On behalf of our co-authors, we would like to take this time to thank ASG, GIE, and the editors for allowing us to present our work.